From United Nations Television, this is UN in Action.
The Pakistani Army offensive in May 2009 took Taj Bibi and her family by surprise. She was 9 months pregnant and very vulnerable. They had just minutes to leave their village before the shelling started. Taj Bibi had to walk for a whole day before getting a ride south.
It was very hard. I had to stop and rest many times.
2 million people fled the Swat Valley. The vast majority found lodging with host families, in schools, or in unmanaged settlements. But more than 200,000 of the displaced found their way to the many tent camps that the government was setting up with international support. Taj Bibi, her husband and daughter, ended up at Yar Hussein, near Swabi. The scale of this joint relief operation is huge. UN and other humanitarian agencies have helped register people, provided tens of thousands of tents, set up mass feeding centers, and arranged sanitation. Various groups address residents' health needs. For expectant mothers like Taj Bibi, UNFPA, the UN Population Fund, has established well-equipped maternal health clinics in 6 of the camps. Taj Bibi went into labor soon after arriving at Yar Hussein. She was just a short distance from the camp's new clinic, but stayed inside her tent due to modesty. After 2 days of severe pain, a social worker found her by chance and brought her to the midwife.
She was anemic and dehydrated. She fainted every time she had a contraction. We feared she would not survive a trip to the hospital, so we made her feel comfortable and delivered the baby here.
It was the clinic's first birth, but not the last. An estimated 70,000 displaced women are pregnant. Every day, more than 250 give birth. 40 or more face potentially life-threatening complications. Female doctors and midwives stay in the clinic round the clock, ready to respond whenever a woman goes into labor. There is a clean delivery room, sterile instruments, and plenty of medicine. Besides assisting deliveries, the clinic staff give mothers pre- and postnatal exams and provide a full range of basic medical services for the entire camp community. Risky cases are normally referred to local hospitals. UNFPA is helping to upgrade their delivery rooms to handle the extra volume. The already high risk of childbirth in this region is compounded by the hardships women endure during flight and in the camps, and by conservative traditions that restrict women to their homes or tents. Bak Begum is 8 months pregnant. Like Taj Bibi, she had to walk much of the way to Yar Hussein camp after fleeing the fighting in her village near Bunair. She lives in a tent with her husband and children. All 3 of her deliveries were at home. She never received any prenatal care before her visit to the camp clinic. Even after meeting the midwife, she's not sure if she will use the clinic when her time comes to deliver.
My mother-in-law helped deliver all of my children. She's not here, but my husband can help this time. He takes good care of me.
Managing Pakistan's crisis is hazardous. On June 9th, a bomb killed several humanitarian workers, including 3 from the clinic support team. The medical services continued without interruption. Thanks to these clinics and their dedicated staff, pregnant women like Taj Bibi and Bak Begum have something they never had before: the chance to give birth in a sanitary place, assisted by a skilled health worker. This report was prepared by William A. Ryan and Mark Westhoff for the United Nations.